Hi, my name is Margaret Miles. I'm a student at Mississippi University for Women in the RN to BSN program. I will be presenting a PowerPoint regarding the risk factors and ethical issues from the complex health alteration, and we've chosen subdural hematoma. This is for NU 469TE1. So like I said, I'll be discussing the risk factors and the ethical issues for a subdural hematoma. So some risk factors for a subdural hematoma, which is a clot on the brain, is what lay people call it, include age. Any patients over the age of 65 are at an increased risk for falls. So they are also, any type of fall or trauma that can lead to injury of the head will cause a subdural hematoma. So, and also alcohol, drug use, or any medications that might alter or impair sensory motor function as well present as a risk for sustaining a subdural hematoma. Alcohol and drugs affect the balance, coordination, certain medications such as pain medications, any type of antidepressants, anything like that might alter the perception of that person. So that would lead them at an increased risk for falling, which would in turn for trauma as well. Other risk factors include anticoagulation therapy. Patients receiving anticoagulation therapy, possibly from a post, DVT or a stroke, anything like that. Certain medications include Coumadin, Eliquis, Xarelto, Pradaxa, are also at a higher risk of developing a subdural hematoma due to the risk of bleeding. These medications are used for thinning the blood to prevent another clot from forming. So any type, even the smallest trauma, fall, anything to that area of the head could easily cause a subdural hematoma on these patients, more frequently than patients who are not taking anticoagulation therapy. So as a nurse in the hospital, our biggest goal is to put these patients at a high increased risk for falls. These patients usually do not get out of bed. We try and assist them whenever they do get out of bed to a bedside commode. Also, just if we can, put them on a bedpan. Also, a part of subdural hematoma is the unknown risk factor. The absence of any risk factors or having a protective factor does not necessarily guard the patient against getting a subdural hematoma. Some patients with no health history under the age of 65 can easily fall. Trauma is also the largest risk factor involved in a subdural hematoma. Also, subdural hematomas are very rare. Less than 200,000 cases per year are reported in the United States. So this is a rare situation, but it also needs to be discussed. So some certain ethical issues regarding a subdural hematoma would be, number one, a consent for treatment. I lined out a scenario. So if a patient comes to the emergency room and is suffering from a subdural hematoma, and is requiring emergency surgery to correct that hematoma, but is unavailable to consent due to an altered level of consciousness, and also a next of kin or power of attorney or medical proxy, anybody who makes decisions for that patient, is not available at that time, how does the hospital respond? Do they go ahead and consent for the procedure, or do they leave it be? And so that's an ethical issue that a lot of hospitals face, whether or not to treat without consent or vice versa. So also blood administration, take the same scenario, patient comes to the hospital unresponsive, no family present, and you don't know their either one blood type. You can always get a path and cross match, but if their religious affiliation, if they're Jehovah's Witness, they don't receive blood. So not knowing, and if they're unable to consent, or like I said, a family member is unable to consent, what do you do? Because if they undergo a procedure and need blood, it's hard to decide on what to do, what not to do. So that's also another ethical issue that hospitals face. So as you see, thank you for viewing. I hope you learned a little bit about my part of the presentation.